Hello, everybody. I'm Dr. Sue.
Dr. George Kardashian.
And at Artlipo Lipedema Liposuction Surgery. And today we're going to talk about the Artlipo Difference. Okay, what sets us apart? And, if you're someone who's been considering lipedema surgery or just liposuction for cosmetic reasons for the arms and legs, which is what we specialize in, you're at the right place, because what sets us apart are the results that we create.
Correct. The results are what patients seek and which is what we can deliver.
So we deliver the most beautiful, high definition, circumferential arms and legs that I'm going to say there's almost no other doctors. There's maybe in the world there's a few. But in the United States, I think we are the best at what we do and delivering the best cosmetic result, which is also the most complete, right?
And safely.
Safety, which we are extremely safe, and we have a great track record. We've been doing this, I've been doing it, liposuction for 18 years. About the last 12 years have been focused on arms and legs. And Dr. Kardashian has been privy to training with me in these very specialized techniques for the last 2 years. So we have a longer track record than just about anybody. There's some other doctors that have been doing lipedema surgery for 10 years or more, but you can check them out. I don't think they're creating the same beautiful results. So it's our results. And let's talk about what a beautiful result is. So if you have a large arm, large leg, large lower leg, you want that to look normal. You want it to be sculpted so that the bulges, wherever they are, bulge here, bulge there, bulge down there, they're all smooth out, that the contours are completely changed to a normal contours, that this is slimmed out, but it's done smoothly. So smoothness, number one. If you can't sculpt smoothly and everything's lumpy and bumpy, that's not the most satisfying result. And I'm not saying we can do a perfectly smooth result all the time, because there are some things that are already there that we can't correct everything. But in general, we do a very smooth result. What's number two?
Number two is patient satisfaction with high definition.
High definition meaning completeness. So when we are complete as can be, we're revealing the muscle tone and contours. So I'm not creating muscle contours that aren't there. He's not either. We're taking the fat so completely and removing that entire layer all the way down so that now you can see the hint of the quads. You can see the kneecap, because so many of the patients that we see have fat down here below the knee, above the knee. And I'm going to tell you, look at some other doctors' work. Please go look at all the other lipedema liposuction doctors out there. Look at their knees. See if you can see the definition around their kneecap, the slimming effect around the inside of the knee, the sculpted nature of the outside of the knee, the contours that come down and form a sharp edge on the front of the tibia or your shin bone. These are all the little features that we bring out, and it's really what sets our results apart. So smoothness, completeness, and then the third. I'm testing it. But the third one is actually blending, okay? So in all liposuction, if you're just doing an area right here, a outer thigh saddlebag, you have to blend it into all the surrounding. This is one of the most difficult things that is a challenge to liposuction doctors. And I'm going to tell you, most doctors don't do it very well. Whether it's a tummy or a bulge here, when you do it, you have to do it so that it looks seamless as it goes into the other areas, and it has to look natural. So the blending is one of the hardest things to do. It's one of the things that I've worked on in my 18 years of doing liposuction, and I can't say I've done it perfectly all that time. I'm still learning. I'm learning new techniques every day, and probably until about 6 years ago, I wasn't blending the very top of the thigh perfectly, and then I kind of developed some techniques that were really able to let me do that. But wherever you end the liposuction, if I'm doing a lower leg, it ends right here. And when it ends right here, you have to slowly blend it so it's seamless. hardest thing in the world is the blending. And we're masters of it. We're not perfection, but we are masters of what we do, and we do it so much better than other doctors. When you look at our legs, they look natural, they look beautiful. When you look at some of the other doctors out there, okay, it's looking a little wonky. You can see the before and after. Some areas are thinned out, but it's looking a little bit bulgy here. The knee is not defined. And in fact, that's probably one of the biggest differences. I think that I have really gone way beyond in defining a high definition knee. And believe it or not, the knee is one of the most important structures to have looking right. If you have a bulgy looking knee, the whole leg doesn't look right. And so many doctors out there don't understand it or are still not able to achieve that, and we do. So please look at the before and afters. That's in a nutshell what results are about. What are great results? Complete, meaning about 80% of the fat being removed. No one gets 100%. No one does. 80 to 90% would be the best that you can get. A lot of doctors are only getting about 50%. Why is completeness important? Because if you don't get it as complete, the lipedema could come back. If you only take 50% of the fat away, it's abnormal. It can grow back. When you leave only 20% of the fat left, it's very hard for it to come back. So it's a very lasting thing. So the other things, the blending and smoothness, those are, pretty self-explanatory.
Yep. And also we do it wide awake.
Yes, absolutely. So why can we be so confident? We stand all our patients up.
And allowing us to look at the areas that need more work, because gravity changes things. So when
gravity changes everything.
Things fall down, and there are bulges that appear that are hard to see when patients laying down.
When they're laying down, everything is just flopped in this fashion, and gravity is making it look better than it is. When you stand up, the skin sags down and bunches up in ways that you can't see when they're laying on the table. So,
which allows us to go back and complete the job.
Yeah. Doesn't that make sense? Years ago, I gave a lecture at a conference, and I said, how many of you doctors do things awake? More than half of them raised their arms, because there were a lot of doctors like myself. Some plastic surgeons, but a lot were not plastic surgeons, and they did things awake. And I said, so how many of you stand your patients up afterwards? A few little hands went up. And why, if you do it awake, would you not stand people up? But I guarantee you that the vast majority of doctors don't even stand their patients up to check the work. And it's such a simple thing to do. It really tells you what the dedication is of a doctor to achieving the best results. That was the first thing I did when I started doing liposuction. Stand up, let me take a look. So yes, thank you. Yeah, that's so important. So I think that covers a lot.
Yes, I think that's what it is.
Join us again for another video, and we'll talk about our techniques even a little bit more, and we'll talk about skin tightening and why our patients' skin looks so much better than other doctors.
See you later.
Bye.